Ladies and gentlemen, you've ever wondered why vitamin D is often called the sunshine vitamin? It's because our bodies produce it naturally when exposed to sunlight. It plays a pivotal role in our overall health. Most people associate vitamin D primarily with bone health, as it facilitates the absorption of calcium and phosphorus, which are essential for maintaining strong, dense bones. However, what many overlook is that vitamin D functions more like a hormone than a traditional vitamin. It influences gene expression, regulates various bodily systems, and interacts with receptors found in nearly every cell in the body. When levels dip to low, a condition known as hypovitaminaceous, peculiar and often overlooked symptoms can emerge. These might include unexplained sweating, restless sensations in your limbs, or sudden bouts of anxiety that seem to come from nowhere. In this discussion, we're diving deep into the 10 most unusual signs that could indicate a vitamin D deficiency. I'll not only list them, but also explain the underlying mechanisms, backed by scientific insights, to help you appreciate just how integral this nutrient is to your entire physiology. Of course, we've all heard the classics. Vitamin D bolsters the immune system. It's helping ward off infections and reducing the risk of frequent colds or flu. Historically, before modern diagnostics, it was linked to rickets in children, a condition where bones soften and bow, particularly in the legs, due to improper mineralization. In adults, chronic deficiency contributes to osteoporosis, where bones become brittle and prone to fractures. But the story doesn't end there. Vitamin D's reach extends far beyond skeletal health, affecting muscles, mood, nerves, and even hair growth. Let's start with one of the more subtle yet persistent signs: unexplained aches in your bones, teeth, or lower back. This isn't just random discomfort. It's a direct consequence of impaired mineral absorption. Vitamin D is crucial for transporting calcium from your intestines into the bloodstream. When deficient, your body struggles to maintain adequate calcium levels, which are vital not only for bones but also for nerve signaling, muscle contraction, and blood clotting. In response, the parathyroid gland's small endocrine organs, located in your neck, secrete parathyroid hormone, PTH. This hormone acts as an emergency measure, leaching calcium from your bones to stabilize blood levels. Over months or years, this demineralization leads to weakened bone structure, manifesting as deep, throbbing pains in the bones themselves, often described as a dull ache that worsens with pressure or movement. Moreover, this process can extend to your teeth. Teeth are essentially modified bones composed of enamel, dentin, and pulp, all reliant on calcium and phosphorus. Vitamin D ensures these minerals are deposited properly during tooth development and maintenance. A deficiency can result in thinner enamel, increased sensitivity to hot or cold foods, gum inflammation, periodontitis, or even spontaneous tooth pain without obvious decay. Studies, such as those published in the Journal of Periodontology, have shown correlations between low vitamin D and higher rates of dental issues. Back pain, particularly in the lower spine, arises similarly. The vertebrae lose density, leading to microfractures or strain on supporting muscles. If you've been chalking up these aches to getting older, it might be worth checking your vitamin D levels instead. Moving on to the second sign: noticeable muscle weakness, especially in the proximal muscles, those near the body's core, like the quadriceps, hips, and glutes. These are the powerhouses for basic activities such as standing from a seated position, climbing stairs, or carrying heavy objects. Vitamin D receptors are abundant in muscle tissue, where the vitamin helps regulate calcium influx. Calcium ions are the triggers for muscle contraction. After a nerve impulse, they flood into muscle cells, binding to proteins that cause fibers to slide and shorten. Insufficient vitamin D disrupts this, leading to reduced muscle strength and endurance. Clinically, this is often seen in elderly populations, where deficiency exacerbates sarcopenia, age-related muscle loss, but it can affect anyone. You might find yourself struggling with tasks that once felt effortless, like rising from a chair without using your arms for support, or feeling unusually fatigued after minimal exertion. Research from the American Journal of Clinical Nutrition highlights how supplementing vitamin D can improve muscle function in deficient individuals, underscoring its role in physical performance. The third odd symptom is a pervasive low mood, or even depressive episodes. While vitamins like B12 are more famously linked to mental health, vitamin D's hormonal nature allows it to modulate neurotransmitters, such as dopamine and serotonin. Dopamine drives motivation and reward-seeking behavior, firing in the brain's prefrontal cortex to help with planning and focus. Serotonin, often dubbed the feel-good chemical, promotes emotional stability and contentment, influencing areas like the amygdala for emotion processing and the hippocampus for memory. Low vitamin D impairs the synthesis and balance of these chemicals. It's potentially leading to irritability, sadness, or apathy. Seasonal affective disorder SAD, common in winter months with less sunlight, is partly attributed to this. A meta-analysis in the British Journal of Psychiatry found that individuals with low vitamin D were twice as likely to experience depression. If you've been feeling unmotivated or blue without a clear trigger, especially during darker seasons, this could be a clue. Now, for something truly quirky, excessive sweating on the head or scalp, particularly along the hairline or forehead. This has been a diagnostic hallmark for centuries, even before blood tests existed. In pediatrics, doctors would inquire about sweaty heads in infants as a sign of rickets. The mechanism ties back to hypocalcemia, low calcium from vitamin D deficiency, which heightens nerve excitability. This overstimulates the sympathetic nervous system, the fight or flight branch, causing sweat glands to activate without physical exertion or heat. We might wake up with damp pillows from night sweats, or notice beads of sweat forming during sedentary activities. Interestingly, this symptom is more pronounced in the cranial area due to the density of sweat glands there, while not life-threatening. It's an embarrassing and uncomfortable indicator that your body is signaling for more vitamin D. The fifth sign is an intense craving for sunlight, coupled with an immediate mood lift upon exposure. This isn't mere placebo. It's a sophisticated evolutionary response. Sunlight on the skin initiates vitamin D synthesis via UVB rays, converting 7-dehydrocholesterol to pre-vitamin D3. However, the feel-good effect happens before any actual production. Your brain detects the light through photoreceptors in the eyes and skin, anticipating the benefits. This triggers endorphin release and serotonin spikes, similar to how the first sip of water quenches thirst psychologically before hydration occurs. Stepping outside perks you up, instantly sharpening focus, easing anxiety, and boosting energy. It could point to underlying deficiency. Evolutionary biologists suggest this craving evolved to encourage outdoor activity in sun-scarce environments. Fatigue and chronic low energy form the sixth symptom, stemming from vitamin D's role in cellular energy production. Mitochondria, the organelles that generate ATP adenosine triphosphate, our cells' primary energy currency, rely on vitamin D for optimal function. It regulates genes involved in mitochondrial biogenesis and efficiency. Deficiency leads to reduced ATP output, making you feel drained despite adequate sleep or nutrition. This extends to cognitive fatigue. The brain, a high-energy organ, suffers from sluggish processing and poor concentration. Athletes and active individuals often notice this first, as performance dips. A study in medicine and science and sports and exercise showed vitamin D supplementation enhanced endurance in deficient athletes. Seventh on the list, hair loss, particularly thinning or alopecia areata, where patches of hair fall out irregularly, distinct from androgenetic alopecia male, female pattern baldness. Vitamin D modulates the hair follicle cycle and aging growth, catagen transition, and telogen resting. Shedding, low levels prolong the telogen phase, causing excessive shedding and brittle strands. Additionally, vitamin D has anti-inflammatory properties. Deficiency can trigger autoimmune responses where the immune system attacks follicles. Research in Dermatology Online Journal indicates that topical or oral vitamin D can promote regrowth in mild cases, though advanced damage may be irreversible. Restless leg syndrome, RLS. That irresistible urge to move your legs at night, accompanied by creepy crawly sensations, is the eighth sign. This links to dopamine dysregulation, as vitamin D supports its production in the substantia nigra, a brain region controlling movement. Low dopamine leads to erratic nerve signals, mimicking early Parkinson's symptoms. Compounding this, hypocalcemia irritates peripheral nerves, causing twitches or spasms. The International Restless Leg Syndrome Study Group has noted higher prevalence in vitamin D-deficient populations, with improvements upon correction. Ninth, brain fog, characterized by difficulty concentrating, forgetfulness, or mental haziness. As a neurosteroid, vitamin D regulates calcium signaling in neurons for precise communication. Deficiency causes noisy signals, impairing cognition. It also stimulates brain-derived neurotrophic factor BDNF, essential for neuroplasticity, the brain's ability to form new connections for learning and adaptation. Low BDNF correlates with cognitive decline, as seen in Alzheimer's research. If tasks like reading or problem-solving feel laborious, this might be why. Finally, the 10th sign: widespread, chronic pain without a clear cause. Vitamin D tempers nasosapune, the perception of pain, by modulating receptors in the peripheral nerves, spinal cord, and brain. Deficiency heightens sensitivity, amplifying minor stimuli into discomfort. It also suppresses pro-inflammatory cytokines. Without this, inflammation flares, contributing to fibromyalgia-like aches. Reduced serotonin exacerbates this, as it normally gates pain signals. Studies in Pain Medicine Journal affirm that normalizing vitamin D levels can alleviate such pain in many cases. In conclusion, these 10 signs illustrate vitamin D's profound impact on health. If several resonate, consult a doctor for a 25-hydroxyvitamin D blood test, the gold standard. To address deficiency, aim for safe sun exposure, 10 to 30 minutes midday, depending on skin tone. And location: consume fortified foods like milk, orange juice, or fatty fish, salmon, mackerel, and consider supplements. A daily dose of 2,000 to 5,000 IU is often recommended for adults. But start lower if unsure, perhaps 1,000 IU, and retest after 3 months. Avoid excessive intake. Hypervitaminosis D can cause kidney issues or hypercalcemia. Natural sources include egg yolks, mushrooms exposed to UV light, and cod liver oil. Lifestyle factors matter too. Obesity can sequester vitamin D in fat cells, reducing availability, while certain medications like anticonvulsants interfere with metabolism. For those in northern latitudes or with limited outdoor time, proactive management is key. Remember, vitamin D isn't a cure-all, but maintaining optimal levels around 30 to 50 ng per milliliter can prevent these odd symptoms and enhance well-being. Stay sunny, folks, and listen to your body's signals.